Welcome back to the science of COVID-19. In this brief video, I want to talk about something called multisystem inflammatory syndrome in children. What does this mean? It means that it's something that affects a lot of the different systems, so a lot of the different organs and parts of the body, and it's marked by a lot of inflammation, and it happens in children. This is a very rare, but unfortunately very severe complication of COVID-19 in some children. These children often need life support. They have these really severe rashes, and unfortunately, some of them have even died from this condition. We don't know why this happens. Most children that develop this have been previously healthy, and in some of these children, these symptoms even develop not right when they get infected, but after some time when they're actually, potentially recovering from the virus. The symptoms often include really severe abdominal pain, shock, which in a medical sense means that their body, their organs are not getting enough blood, and so they're becoming damaged. So I'm talking about organs such as heart, liver, lung, kidneys, and so forth. They have really bad rashes, conjunctivitis, signs of meningitis, really swollen lymph nodes. Their skin is peeling off at times, and they have difficulty in getting enough oxygen into their lungs and into their body. Fortunately, the number of cases that have occurred so far worldwide is not that high. So in the United States, for example, this is the number of cases that each state reported since the beginning of the pandemic until about mid-May. You can see that there are a number of states that didn't report any cases, whereas the most number of cases occurred in either Michigan or New York and reached about up till 30 cases. The other interesting thing about this syndrome is that, as I mentioned, in some children, it seems to happen towards the end of the course of the viral infection. So almost as if the body has been fighting the virus for some time, and then these severe symptoms appear. In this chart, using data from March 8th through about mid-May, the red bars represent the number of cases that have been reported across the United States in children or individuals less than 21 years of age. And this yellow graph represents the percentage of people testing positive for SARS-CoV-2. So interestingly, the number of cases of this multisystem inflammatory syndrome seems to be rising past the peak of when most of the children were testing positive. Again, we're not sure what the reason is for this lag, and this is one of the really intense areas of study within the science of COVID at the moment.